So it's interesting that you have a different focus because I think Marty and John would both say that in a sense their investment thesis is access and convenience, and yours is in a way behavior change.
Right.
Right. Any evidence so far to support that we can actually change patient behavior?
Well, we have different trials, and what we see is that there's a huge impact in terms of glucose control, for instance, in diabetics. If they have a cellular phone with a glucometer, it's a significant difference. So we can see higher compliance, up to almost 60% of compliance, not only in terms of measurement, but in terms of drug administration. And also, if we have a follow-up and have a monitoring system to do their physical activity or any other things, it's really like a bonding process where the system, and you can also have through the cloud, the system can also be much more aware of what each individual is doing. So it's an interesting perspective. It's individually, but at the same time you have a community, and you can even make a bit of a benchmarking within the community to know if you're doing better or average as the rest of the group that you are in.
And Roberto, you may we didn't discuss this beforehand, so you may not know, but you have a long background in public health. So 60% compliance compares to what beforehand, and how much of a difference does this make compared to other public health programs you tried to run?
And remember, this is on a trial process. This hasn't gone to the real life process, but I can tell you that in real life it's less than 20%. So I would say that it's going to make a great difference in terms of the consequences that we're seeing due to the non-communicable diseases epidemic that we have.
Do either of you have a perspective on behavior change? I mean, Marty, I don't know if you were an investor in a disease management companies, but I'm sure you followed the space closely, and obviously the numbers and impact were much, much less, in the order of what Roberto was talking about. What do you think now we're actually poised to drive behavior change?
So we were actually investors in a company called Core Solutions that was a disease management company. Before that was a term of art, but I'll have to thank you. You've given me my podium. I found my pony. Somebody asked about that earlier today. This could be controversial, but I think behavior change is really hard. And I think as a society, we devote a tremendous amount of capital and resources to wellness, banking on behavior change that is very hard to drive. And actually, Steve and I were talking about this just prior to this session. We've got an issue in this country in that 5% of the patients, and Ted, you alluded to this beforehand, I'm part of the 5%, so I'm biased. 5% of the patients account for 50% of the costs. And we spend all of this capital, time, and resources trying to drive prevention to a society that's inherently short-term oriented. And we've got all of this low-hanging fruit, that where there's very little resources devoted to. I'm on a biotechnology drug that costs $100,000 a year. This is an amazing story. I'm on a biotechnology drug that costs $100,000 a year. I've been on it for 12 years, $1.2 million. I have never gotten a call from my health plan. I got put on 5 milligrams of an ACE inhibitor for prehypertension. I got called in 3 days. So
I completely agree with Marty. I think behavior change is really hard. We're getting a chance in the healthcare system to be incented to try to figure this out. If you take the CMS rules are that if someone is readmitted to a hospital within 60 days, the hospital is responsible for those charges. That can be very expensive for the hospital, and that's 5% of the population who really are the chronic care population. They have multiple doctors, they have multiple disease states, and they actually are readmitted several times within that 60-day period is typical. So it's a real expensive problem to solve. And as Dr. Oz said last night, giving people more information doesn't do much to change people's behavior. It's getting people to feel that they want to do it. And the biggest obvious problem we have is obesity. If we get everybody to lose 20 pounds, we would lower the cost of healthcare in the country. And the people who are most abusing it are the chronic care patients. What we've seen in some other things I've been involved with is that if you just get people to weigh themselves every day, nothing more complicated than that in technology, just weigh themselves, it gets them aware that their weight is rising or is too high. So I think technology can help, but it isn't going to be the whole solution. The people who will change their behavior the most tend to be the healthiest people. So that's the well-care side of the issue. They're the ones who are wearing Fitbits and running and keeping in good shape. And the people who are in the worst shape are the hardest ones to change.
We're going to go to the audience in a few minutes for questions, so I just wanted to give you that prompt to prepare if you'd like. What about quality metrics? So you said we can't get people to change their behavior. We don't really provide much in the way of quality information. Are either any of you looking at any of those opportunities? And if so, what looks most promising?
Well, we're trying one. We have a company called Audax Health Solutions that's dealing with the problem that as the industry, this employer-based healthcare system of ours, moves to self-insured corporates, the role of the payers is turning into BPOs. That's not as good a business model as to be selling the complete insurance. So the payers want to have a relationship with their members. The problem is the members hate their payers. So there's an opportunity out there, we think, to build engagement engines where you can start to get people engaged. When I say people, it's really women, because women make 85% of the health decisions for the family. So it turns out women are the most active gamers in the world. It's not teenage boys anymore. It's women, but they're doing puzzles and relationship type games. Well, getting them engaged in activity that can influence their health, and they represent their kids and their extended family, is a real priority for not only the employers but also for the payers. So we're building a service. You could think of it like something between Facebook and Zynga, except it has to be HIPAA compliant and it has to be able to deal with very confidential medical records. The thing we don't know is how much impact we can actually have. So we'll know an awful lot more in 12 months than we know now. But it's one of the promising opportunities, we think, where you really can have some impact on behavior.
What in the world of well, let me shift gears for a moment before we head out for questions. Let's talk about obstacles.
About what?
Obstacles for a minute. So we heard Daniel introduce the world of technology, and immense as it is. You're all looking at all of those things to invest in and to drive returns and improve patient care. What are the obstacles to doing so? Where are you running into most obstacles?
Technology is not the obstacle. The obstacle, I think, is that I'd say, why are there so many innovative companies being built in Silicon Valley, first with consumerization of consumer electronics, and now those ideas are carrying over to the enterprise, and you see so few success stories in healthcare? And I think part of it is domain expertise. You remember when Google Health started, it's not around anymore. Reportedly, they commingled claims data with clinical data. It was all data, but it's used for very different purposes. And so if you don't have the domain expertise of the industry, as Malcolm Gladwell says, it takes 10,000 hours. I've got my 10,000 hours in technology and consumer marketing. I don't have it in healthcare. I think I have about 6,000 or 7,000 hours. I've been doing it for 7 years. But there are very few people in Silicon Valley who have the domain expertise of technology and healthcare. And so it's going to take a while. So I think the obstacle is the technologists don't know enough about healthcare yet. The healthcare people don't know enough about technology. And it's just going to take a while for us to build enough critical mass of people who know both.
I want to change to a little bit of a different system. Oh, sorry, Marty.
I was just going to say, I think the obstacle historically has been reimbursement.
Is what?
Reimbursement.
Yeah.
There's been a lot of innovation in the market. I've been invested in healthcare services and healthcare IT for 15 years, working with companies in these sectors for 20, and there's been no shortage of good ideas. The challenge is that we've got a third-party reimbursement system in this country where there's no real customer. And again, this is something we were talking about last night. At the doctor's office, the nurse is the customer. The doctor is the customer of the nurse, not the patient. The insurance company is the customer of the doctor, and we don't fit in anywhere. And so there's been very little of an impetus because of the third-party reimbursement system to adopt this innovation. And it's historically been a reasonably thin margin business. I think one of the really positive aspects of healthcare reform is going to be driving more and more individuals into individual purchasing decisions. I have to go online and buy my insurance in the same way that I buy auto insurance, and that's going to force me to be a smarter shopper. And when I'm forced to be a smarter shopper, I'm going to purchase along two lines. It's either going to be cost, and you don't want to be a commodity provider, right? Yeah. Or I'm going to do it on quality, and there are two aspects of quality. One aspect is clinical outcomes, and that's very hard for us as average healthcare consumers to ascertain. And the other aspect of quality is service, and that's actually really easy to ascertain.
And I would add, at least in our experience, is communication skills. Yeah. Once you have a patient that has a higher more information, it poses more questions to the physician, to the health provider. So you need a health provider that now has additional communication skills to explain a number of things, or even to be put on the bench in terms of be a questioning process. So what I've seen is that sometimes the resistance comes from the health provider in our scenario, because it's changing the power of the information. So I would say that we have to be careful and always make sure. Our first experience, we thought that the innovation could go directly to the consumer. And we had to make a step forward behind, because we had to go through the health system. And that's something that has to always go through the health system. If you want to send it through the patient, it's not going to be a link to the health system. So I would say it's communication. It's the power that you're changing the center of the power between a traditional, let's say, interaction between a physician and a patient. It's totally modified.
And I'd like to make an observation just about walk-in urgent care centers. First of all, disclaimer, I'm not invested in a walk-in urgent care center, but I'm very interested in it because it's really a pretty big developed business. And the thing which I think is interesting is that if you go to an emergency department, you can wait an hour in an urban market or longer. That procedure may cost the system several $1,000s. And yet, if you go to a walk-in urgent care center, of which most are owned by hospitals, they have shrink-wrapped. It's like Bill Gates invented shrink-wrap software. They have shrink-wrap procedures into $50 up to $300 procedures. And they guarantee you no more than an 8-minute wait time. There's a doctor there from 9 in the morning till 9 at night. And you pay a fraction of what the cost to the system is for an emergency department. And the hospitals like it because it also gives them a pipeline of feeding patients into the hospital to fill beds. So that's a disruptive healthcare delivery system. I think that's only one of many ideas that are going to disrupt the way healthcare is delivered. The innovation in medicine has been with brilliant technology for better medicine. It hasn't been much yet in innovation in disrupting the way healthcare is delivered. And I think that's the big opportunity. And if you start to look at that, then reimbursements, which is a real obstacle, as Marty says, I think that we're going to see some breakthroughs where consumers are paying out of their pocket because of high deductibles, and they are not getting outrageous prices. I mean, huge discounts off of what they're paying today.